It should be recording now.
Y'all ready?
Yeah, it's recording. Does it
Okay.
tell y'all it's recording or no? Okay.
Okay. Hello, we are students from Xavier University of Louisiana, and we are currently enrolled in a Black Health Disparities class. And today we will be discussing Black maternal health. My name is Tamaya Harris.
My name is Darnicia. Wait.
My name is Brianna Lee.
My name is Annalise Ladd.
And my name is Kennedy Sledge.
And to start off, I wanted to define the problem. So, in this discussion, I will argue that we are in real time dealing with the Black maternal health crisis that stems from past problems that have yet to be resolved. I say this because there are many Black women who are pregnant that are suffering and encountering pregnancy related issues more than any other race or ethnicity. This discussion will discuss Black maternal health as a whole and the root causes that are causing inequity to occur for Black pregnant women. So, in history, we all know about how Black people were treated, and now it's starting to impact Black pregnant women. And in one of our readings, Battling Over Birth, in our class, they stated in the book that Black women are 3 to 4 times as likely than white women to die of pregnancy related causes. So, Black women are like more endangered when it comes to pregnancy, and they have like more problems because not only is it the body and genetics, it's also the systemic racism and institutional racism and every other inequity that has been in the past. Mm,
Okay, so I will be discussing how this issue is Black health crisis is disparities that disproportionately harm Black women. I say this because Black women, including those who are highly educated, face high maternal mortality rates due to societal stress, implicit bias in health care, the impact of the crisis on Black. So the Black maternal health crisis disproportionately affects Black individuals, particularly Black women. Um, okay, as highlighted in the video inside Georgia's maternal mortality crisis, educated Black women are 3 times more likely to be affected by maternal mortality than other ethnicities. This um, education and socioeconomic status alone protect against maternal mortality and structural racism within the healthcare system that's often placed on Black women at heightened risk regardless of their social standing. And then when Black pregnant individuals enter labor feeling anxious or fearful of death, as noted in the reading Battling Over Birth, when pregnant individuals enter into labor feeling anxious and afraid not only of the process of birth, but also the possibilities of death, they are vulnerable to coercion and control by others. And their experiences and systemic failures exaggerate their disparities in healthcare, which leads to negative birth outcomes. And this includes maternal mortality and severe complications. And organizations like Black Mamas Matter Alliance play a pivotal role in addressing these issues. BMMA advocates for policy changes, community-based care models, and the redefinition of maternal health to consider social and economic factors. How can we solve the Black maternal health crisis? As they state, health isn't produced in the four walls of the clinic, it's produced in people's homes, in their communities, in their workspace. This shows the importance of the holistic care approaches that extend beyond the clinical settings and address the broader social determinants of health, such as housing, food security, and workplace conditions. In order to confront the Black maternal health crisis, it's crucial for us to ask these questions, which are, how can healthcare providers be held accountable individuals? And also, what role do social determinants of health play in shaping maternal outcomes, and how can these be improved in marginalized communities?
Before we go on, I did want to touch on what you just discussed about the physicians, like bettering them. Um, I had read in an article by Dr. Sabin on an AAMC article. It's been like a belief that's been going on for many years that Black people's skin is tougher than white people. And I feel like that plays a part in the physicians like knowing a Black person's body, because if their mind is just revolved around the myths and the beliefs that stemmed from the racism from back in the day, I feel like that will have the negative impacts on Black pregnant women as well.
Before I get started with what I worked with, I wanted to speak on how you said when Black moms they go into labor afraid and stuff, they tend to be controlled by others. My sister, she has 3 kids, and that happened to her during her second pregnancy. That was because she had a C-section on her first one that she wasn't supposed to. So this time she went in a little scared. They were very rude to her. Of course, she was surrounded by people who weren't people of color, but like they wouldn't listen to her when she said something was wrong, and that led to her almost losing my niece because the day she went into labor, she wasn't supposed to go into labor. The sac popped, and I don't know if y'all know, but this when the sac pops, the baby's not receiving oxygen, and it's a possibility they'll die. So her experiencing that almost cost her not just the baby's life, but her life as well, because she was having trouble breathing, she was having complications, and they said if she didn't get to the hospital when she did, the baby could have died. So I definitely have not firsthand experience, but secondhand experience seeing it happen to my sister because it all happened at home early in the morning. But I also focused on the impact the Black maternal health crisis has on Black people. 1 second, move the screen. Okay. So, with my discussion, I will argue that the Black maternal health crisis creates a negative impact on the Black community as factors such as systemic racism, discrimination, and neglect instill fear in our Black mothers when they have to deliver in a hospital. I say this because fear can contribute to even more concerning factors such as delayed care or stress on the mother and the baby, causing an increase in the maternal mortality rate or premature birth. And some evidence I have to back up this is in the book Battling of a Birth, it says 55 participants reported being anxious or afraid about their process of birth, labor pain, and the possibility of death and disablement for them or their baby. So this one woman, her name was Sage, she was 36, and she gave birth through vaginal birth. And she didn't get an epidural, not really because of her choice, but because of her husband's, because her husband's family had went through something very traumatic. His aunt had got an epidural and they didn't document it. So when they moved her to a different room and she said she was still in pain, they gave her another epidural, causing her to have a lot of complications. I can't remember what exactly she went through, but I think it was a coma. So with that happening with her husband, he was very adamant about her not receiving any medication. So she went through that entire birthing process in a lot of pain, no epidural, no anything, not even Tylenol. So with that happening to her, that was very traumatic, and that caused her to be afraid to, you know, have children. Just that process alone was just very traumatic for her. I also have evidence from the video we watched in class covering expectant Black mothers find support with doulas and midwives. And it talks about a mother named Justina. She had, I think, 3 kids. She was a mother who planned to have a vaginal birth after having a traumatic C-section with her first child, and how she was faced with another C-section for her second child. And if y'all don't know, 2 C-sections back to back, that's very dangerous because a lot of stuff can go wrong with C-sections. Like the stitches, they can get infected, they won't heal properly. So getting cut in that same area again, that can cause a lot of complications and maybe even death from infection. So she was supposed to have a vaginal birth, but her doctor convinced her to do a C-section just because she was going to be in labor for 2 days. So like they were just very adamant for her to like have a C-section instead of just letting her be in labor for that 2 days. Because I know plenty of people who that has happened to and they were just fine. But just because it was convenient for them, they wanted to convince her to do a C-section. So she went ahead and did that. And after that, Justine and her husband were very adamant about having a vaginal birth for their third child. So they didn't even go to a hospital. They rather did it at home with a doula. And that has even greater risk because it's associated with 2 times increased risk of potential death and 3 times increased risk of seizures or serious neurological dysfunction. And I also have another piece of evidence. Hold that. So this piece of evidence comes from Black women living in LA, and as well as other major cities in California reported that their symptoms of depression and or anxiety were dismissed by their obstetric provider or misdiagnosed as side effects from medication. And this neglect may reflect underlying obstetric racism or systematic racism, if you will, discrimination, and further erodes women's trust in healthcare providers and hinder them from disclosing symptoms of pre- perinatal mood and anxiety disorder. So this happens a lot within the Black community. Often say like Black women are dramatic and always angry and all of that stuff like that. So they often don't listen to women when they say something is wrong. So this causes a lot of high risk pregnancies, premature birth, and a steady increase in the Black maternal health crisis. And that is all I have for now. If y'all have any input or want to speak on anything I just spoke on, be my guest.
I actually would like to speak on a few things that you mentioned. I like the fact that you mentioned like the conversation of like a C-section because as mentioned in class, we talked about how for Black women, there was an epidemic of C-sections going on. And we pondered on like why this was happening. And I think you like hit it right on the head by saying like it became like a quicker alternative to get Black women in and out of the hospital. Because in your section, you mentioned that that specific woman would be in labor for 2 days, whereas she can have a C-section. It would be a much faster process. So we see this lack of empathy during a very emotional and like pivotal moment in these women's lives. And then I also like the fact that you mentioned how they think that Black women over exaggerate their pain, which often leads to medical harm against Black women disproportionately, because there is this notion of the strong Black woman that continues to harm Black women bodies. So, yes, thank you.
And I also wanted to add on, I agree with Kennedy because really it's like pregnant women just need support like during the time of their pregnancy. And most of the physicians and the people who are in these hospitals are not really providing that support that we need because we already are fearful based off past experiences that happened with Black people. So we already got a fear and distrust in the system. So we just need that added on support, and how Bree touched on from the video about the Black expectant mothers. They talked about doulas and how doulas are two, if a Black pregnant woman was to go to a doula, they are 2 times less likely to have complications than any other Black mother that will be in a hospital, because doulas are actually there to support, care for you, and like actually listening to your needs rather than hurry up and get you out.
I also wanted to add, when I was talking about the woman Sage who was in the hospital, who didn't get an epidural because her husband's family had went through something traumatic. So the aunt that all happened to, they were also going to take her off life support, even after they knew like what they did caused her condition. They were just going to take her off life support, and they said it took them laying her baby on top of her for her to start breathing again and for them to get a pulse. So, yeah, just wanted to mention that.
So, so at large, we understand why Black women lack reproductive equality and justice. It's simply a byproduct of systemic racism. However, with analyzing in-class readings such as Battling Over Birth and Maternity Care Deserts and Pregnancy-Associated Mortality in Louisiana, as coupled with outside sources like Black Women's Maternal Health, we then begin to see how systemic racism has created a multifaceted barriers that Black women encounter in the healthcare system, ultimately contributing to inadequate maternal care and alarming rates of maternal mortality. So, in Battling Over Birth, the personal birthing experiences of Black women in California are revealed, which illuminate how childbirth for all Black women in America is marked by fear and uncertainty as they deal with one of the most difficult moments in their life, all while their voices and concerns are being ignored. We see this crystal clear in the experience of a woman named Delilah, who at the time of her birth remembers battling with hospital staff about her birthing position. While in active labor, Delilah remembers positioning herself um, on her hands and knees as it that seemed like a comfortable position for her. And then she also remembers fighting with her doctor and her telling her, no, you have to get on your back to have the baby. And they continued to go back and forth. And finally, the doctor said, very in an aggressive manner, nope, you're going to have to flip over. And then Dialogue recalls just remembering, it took everything in me to get on my back, but I wanted to have this birth and he was coming. So we see the lack of autonomy and empathy given to Dila underscores the absence of agency Black women have while giving birth, ultimately leading to high maternal mortality rates or just them experiencing more pain than they have to. Furthermore, the article Maternity Care Deserts and Pregnancy-Associated Mortality in Louisiana sheds light on the geographical disparities that exacerbate these issues. In Louisiana, many regions are classified as maternity care deserts, where access to prenatal and postnatal services is severely lacking. This lack of access disproportionately affects Black women who are more likely to live in underserved areas. Additionally, reading more into this using an outside source titled Black Women Maternal Health, it draws attention to how Black women and birthing individuals, regardless of their socioeconomic status, are 3 to 4 times more likely to die from pregnancy than their white counterparts. Therefore, the article encourages cultural competency in healthcare and the need for healthcare providers to recognize and address the unique experiences of Black women. The lack of representation among healthcare providers can lead to a disconnect that undermines the quality of care of Black women. When healthcare professionals do not understand or are not trained to address the specific historical and societal context of Black women's health, the care they provide can be inadequate or even harmful at times. So, all in all, the article advocated for more training and awareness among healthcare providers to ensure they can deliver care that is both respectful and responsive to the needs of pregnant Black women.
I wanted to add on to what you said about I forgot her name, the lady who had to fight with the doctor about her birthing position. I don't know if y'all know, but I learned this in like high school. To my knowledge, that birthing position came from King Henry. I can't remember which King Henry it was. It's a lot of them, but basically, he had this birthing chair where he would have his wives, because he had multiple wives. He would have them sit there in front of him while they're giving birth and do some very odd things to that. So that, to my knowledge, that's where they came from. So like that little myth about laying on your back is the safest way to, you know, give vaginal birth, that's a lie. They just go with what they're taught and move on instead of trying other things and listening to people who are like in pain when they're in that position. They just think that's the best because that's what they've been told instead of actually doing studies on that and like experimenting with other birthing positions. Because I know multiple mothers who have gave birth at home in a squatting position said that was way more comfortable than their being on their back, and that prevents them from having back aches in the future after, you know, healing from that vaginal birth. Yeah.
I like the fact that you mentioned like historical context. I want to add more to it. So, Dr. Sims, who is like known as the father of gynecology, he actually it's kind of crazy that the law like in this state wanted to be in this position because he um, placed enslaved women in that same exact position without using anesthesia or anything like that, and just operated on them for the sake of uh, gynecology like advancements. And so we see how like the parallel between Black women being exploited or ignored in a sense, in both regards, of like of their wants, and like being just completely stripped of their autonomy, and their bodily rights. And sadly for Delilah, like she was actively in labor while arguing with her doctor about what position she feels most comfortable in. And it's also sad that the doctor didn't listen to her because she ends up being completely ripped after giving birth to her child. And she was trying to listen to her own body, but in the act of like despair and like the baby actually coming out, she was just like, okay, I'm just gonna have to, bend over and like, whatever, do what you say. So we just see how like they wait at the last minute to where like Black women are almost at the mercy of them to be like, I'm gonna demand you to do something. Um, which has really disturbed me in a lot of ways.
It's really
Yeah.
shocking that but oh I can oh okay sorry. I was just gonna say like it's so crazy how Black women have to like push so hard when they're in the presence of these doctors and these nurses to get what they actually need. I actually found a statistic from the PEW Research Center, and it says that 71% of Black women said between the ages of 18 and 49 have said that they've had like at least one negative experience with a healthcare provider. And almost like all of the Black women in the study said that they had to actually speak up to get that proper care that they actually needed. And about for the older woman, it was about like 54% said that they had a negative experience with the healthcare worker. So I feel like maybe this issue, it shows how this issue has progressed over time. So it's, yeah, it shows how this issue has progressed over time. And it's just crazy how we have to just push so hard to get the care that we need instead of it just being provided to us.
And I was going to say more about the birthing position, about like us them wanting to like not lay on their back. It's also because when you lay on your back, when the baby comes out, it pushes on the vaginal wall, so that causes tearing. So a lot of women figured out that switching positions like squatting or on your knees, that helps you prevent tearing and having to get stitches and stitches that can get infected. It's just a lot of things that can be prevented, but we have doctors who don't want to listen, especially if you have one that's like been a doctor for a long time. So say for instance, not even just the doctors, the nurses as well. Nurses that started in like the 80s or the 90s, they're so stuck in their ways that they feel like they know everything. So they don't allow you to like do what you want to do what makes you feel safe and things of that nature.
Yes, and I also want to go back to something that I mentioned. I want to highlight maternity care deserts and how this directly impacts Black women's um, health and the health of their children. So in Louisiana, it is estimated that majority of Black women are living in maternity care deserts. Um, and their access to prenatal and postnatal services is severely lacking. And if they do have access to this care, it is inadequate, and they are often left feeling like their voices were not heard, um, making them like unwilling to go back to these services, putting them in more danger, um, and their babies.
Do y'all have any other answers other than like what we've already talked about that could answer the two potential questions in the beginning, which were how can healthcare providers be held accountable for addressing implicit bias? And what role do social determinants of health play in shaping maternal health outcomes? Everything.
Could you repeat that one more time? You kind of broke up a little bit.
How can healthcare providers be held accountable for addressing implicit bias and improving outcomes for Black birthing individuals? And what role do social determinants of health play in shaping maternal outcomes?
To answer your first question, I think there needs to be a systemic change in how doctors and nurses are being trained all around the world. Um, there are still records that they're still being taught that Black people can still withstand higher levels of pain and things of that nature. So if we continue with these notions, it's only perpetuating a cycle of harm for Black people, and more specifically for Black women and their babies. So I think like also I mentioned this when I was speaking as well. Hospitals need to encourage cultural uh, competency in healthcare, and also recognize that people of color have unique experiences with the healthcare system. Um, so there is like a different level of care you have to administer to Black people.
I agree. I really feel like you mentioned before, it's like a lack of empathy and care in the physicians. And once they gain that, I feel as if any health issue that deals with Black pregnant women and just Black people in general will be better. And I also did want to answer that second question as well. I do believe that social determinants play a major role in the Black maternal health crisis. And I say that because in a battling over birth, I had another piece of evidence that discussed the stressors that affect women pregnancies. And some of those stressors were racism and environmental stress, economic and job related stress, and like parenting stress. So we all know that pregnancy, well, we might not have already experienced it, but in the in a different perspective, we have seen people go through pregnancy, and we all know that it's not an easy journey or an easy experience. And on top of that, it's Black women who don't have adequate health insurance, so they're not getting the proper prenatal care that they deserve, which is causing difficulties in their pregnancy. And then even the environment as well. We know back it was an opioid crisis. Black women or just women in general was exposed to the crack epidemic, and that was causing people to have crack babies. So the environment you can live in can also cause damage to Black women pregnancies as well.
So that's a really good answer. I wanted to add on to the first question about what can we do to hold these healthcare providers accountable. I think one thing we can do is having more group-centered care when it comes to pregnancy. We talked about this earlier in class, but also, um, and it's just a thing for Black families in general to be really involved, like when their family member is having like a health issue or like something like a big health event, like a pregnancy, to just be there for them to make sure that the workers are being held accountable. But also, when it comes to, we talked about in class, when it comes to other parts of the world, like in Europe, Asia, Africa, pregnancy is like a more group centered process. So it'll be groups, like prenatal groups of these pregnant women gathered together, rather than here, it's more like we have short visits with our OBGYN or the doctor who's taking care of us. It's more of like more like a self-centered process. But if it's in a more group setting, I feel like not only are the women able to support each other, but also I feel like the healthcare providers are held to a higher standard, because now you have a group of women who all are facing the same experience when it comes to their health. So I feel like that in itself could be something that would help to lesser the disparity and hold these doctors and nurses to a higher standard when it comes to culturally sensitive care.
I also wanted to say a way we can hold them accountable is, implementing the rules in its entirety. Some hospitals, they'll slide stuff under the rug, such as like discrimination or anything like that, if it doesn't qualify as malpractice, simply because the nurse or a doctor is really good at what they do, but they're not thinking of to whom. They're good at what they do to non-people of color, but to Black women who are already facing this crisis, that's not the case. They're constantly facing the discrimination and nobody's doing anything about it just because they don't want to lose a doctor or a nurse, because we are in a nurse shortage. I'm not too sure about the doctor, but I know for certain we're in a nurse shortage. So sometimes in that realm, they think about it that way instead of thinking about it the way they need to.
With all of y'all. And that's why I think it's important that we do have organizations like Black Mamas Matter Alliance. They're an organization that is dedicated to advancing Black maternal health rights and justice. BMMA also focuses on addressing systemic inequalities and contribute to disproportionately high rates of maternal mortality among Black women. Um, so to confront the issues that we have with Black maternal mortality, it's crucial for us to consider. Wait, my bad. it's crucial for us to get involved with organizations like Black Mamas Matters, like Black Mamas Matter. Um, we can do this by going to their website at just to raise awareness on your personal platforms. Um, because it's important to be a part of something, especially as Black women. It's important for us to get involved in these organizations, trying to um, gain resources and support for the issues that we face.
I also wanted to add that it's important to if you are able to get back to your communities. So like for those places where like there's not too many prenatal care or people with health insurance, helping them get resources to get that prenatal care and to get that health insurance if you are able to. It's always important to help your community first before branching out anywhere else.
That's true. Is it okay now if I share my perspective on the issue that we're talking about? So, I argue that Black maternal health can be improved by incorporating culturally informed and sensitive healthcare practices into all medical facilities. And I say this because the healthcare system often fails Black mothers due to systematic racism, which causes disparities in our children's health. And I discuss specifically how Black mothers are affected and the importance of inclusive care. Um, so one statistic that I found interesting from the CDC states that in 2021, the maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 100,000 live births, which is almost 3 times the rate of non-Hispanic white women. And I thought it was interesting because it shows that the Black maternal mortality rates remain disproportionately high, regardless of education level, income, or anything. And it shows that structural racism is really the cause of these disparities rather than the individual. Um, and it also shows that Black women's maternal health it's kind of impacted by intersectionality. So like both race and sexism have like a play in it, and it shows that um, we kind of need more like community driven programs, so like those with like Black doulas and midwives, and maternal health advocates, to improve maternal outcomes. And I think that like culturally informed practices can build trust between Black mothers and healthcare systems. um, and another thing I wanted to bring up from the Battling Over Birth book was a quote, and it says, while all pregnant individuals can be impacted by these representations, Black women deal with an additional set of potential fears that are related to racial disparities in maternal health outcomes. And Black women in California remain 3 to 4 times as likely as white women to die of pregnancy related causes. And our infants are twice as likely to perish in the first year. 1 in 6 African American babies are born too early or too soon, increasing their vulnerability. Um, and so Black women face maternal mortality rates that are 3 to 4 times higher than white women, even in states like California that are so progressive and have like um, more progressive policies when it comes to their healthcare. And structural inequities rather than like biological differences drive these disparities. Um, and so Black infants are twice as likely to die in their first year of life compared to white infants. That's kind of like an indicator of the systematic failure when it comes to prenatal care for Black communities. And I think that a contributing factor to this could be like the stress from being racially discriminated against. And lastly, I wanted to bring up a quote from the study that we looked at when it comes to incarcerated Black mothers. um, Higher parish level in Louisiana, higher parish level incarceration prevalence for Black individuals were associated with significantly greater risks for preterm birth among parish residents. And these results suggest that mass incarceration may, at least in part, contribute to racial disparity in adverse birth outcomes in Louisiana. Moreover, this association was not explained by greater prevalence of crime in areas with higher incarceration, as demonstrated in the sensitivity analysis, implying that Prevalence of incarcerated Black persons may be an important marker of structural inequality and a determinant of adverse birth outcomes among Black women. So basically, what I'm trying to say with this quote is even if we weren't already sure that there were disparities in Black maternal health, the quote kind of shows even further that it's worsened when the outside conditions are worsened, our disparities are. And the outside condition in this case would be incarceration. And it shows that like the prevalence of incarcerated Black people is kind of like a reflection of the structural inequalities and that systematic racism and a lack of resources in Black communities is like shown through this. And it shows that adverse health outcomes among Black women aren't a coincidence, like they're tied to a larger injustice, which is racism.
I wanted to speak on what you said about the Black mothers being incarcerated. Also, what may play a part in like the premature birth or the mortality rates is what they're being fed while being incarcerated. I mentioned that in my presentation in class weeks prior, but like the water there is not good. It's very harsh. Like just like we're in New Orleans, we have not that best um water. It's really terrible in prison. It's very dirty, it's not clean at all. They feed them any and everything, and it's either you eat or you starve. And some people they will starve. So um that messes with the baby, that can cause the baby to be premature, malnourished, and things of that nature. And they also when they give birth, they do not like they can't keep their babies 24/7. So like they can't nurse all the time. They might have to automatically put their babies on like Similac and stuff like that. So that can also contribute to the Black maternal mortality rate.
Exactly. And that, oh,
You could go ahead.
I didn't really have that much to say. I was just going to say that, yeah, exactly that. And that's how probably almost all women are treated. So you already know if when it comes to Black women who are incarcerated, they really don't care, like even less. It's going to be more of an issue.
And I just wanted to add on like a random fact that I found from the CDC, a study from this year. I found that they said that 80% of pregnancy related deaths are actually preventable. And that was real intriguing to me because it's really just showcasing the fact and idea that physicians are not really doing what they can, doctors, nurses, whoever is dealing with these pregnant women, they are not taking the steps or the necessary steps to actually make sure that they have a smooth pregnancy without any complications. And as stated before, it could be the result of systemic racism, the lack of empathy that they have, and it's just a lot of factors that can tie into it. But it was just really crazy that majority of these pregnancies are actually preventable.
I think I also seen that fact too, and I think it also points to the fact that like they really just, and I'm probably just emphasizing on what you said, they really just don't care about the life and legacy of the Black community. Because um, to directly like harm Black women, because I also remember, I don't know if y'all are familiar, there was this like really popular event in the news that when a Black woman gave birth, her physician was using so much force that he decapitated the baby's head off. Um, and so it just shows how like there is this overuse of force and just lack of care when it comes to Black women's reproduction.
I feel as if what you done? I'm sorry.
Yeah, I was done. Yeah.
And that's why I feel as if it's important for people to look like us, in these positions where they can take care of us, because it's like history, quality health care. We lack access to many things that know the things that we go through to be in that position. Stand the cries that we are crying out to them about, and we having to explain and nobody listen to us or anything.
I wanted to speak on the situation about the doctor decapitating the baby's head. I don't know if y'all followed that story, but I kind of did. And that family had to go through so much just to receive a simple amount of justice. I'm not too sure if the man has lost his license or not. I would hope so, but they had to go through so many press conferences, so many trials, just to even be heard about their story. And we all know if that was a white lady and their baby, the man would have been in jail that day. And I just find it really crazy how people don't take what happens with Black women and Black families that serious as to white counterparts.
Yes, I agree. And I also think, oh, I'm sorry, go ahead. I was going to say, I also agree. And like, although I didn't follow the story closely, I remember the woman mentioning that after the physician did what he did to the child, he and everybody else in the room were accomplices, you know, almost pretending like everything was okay. And that also just reveals how like there is no humanity when it comes to the care of Black people, specifically Black women in their bodies. Um, and this systemic issue is only worsening as the years progress. So, Arnesia?
So with everything that was said, I think it is important for people to reach out and get involved with Black Mamas Matter, with the Black Mamas Alliance organization. Again, their website is blackmamasmatter.org, and you can get involved by donating and advocacy personal